some people run away from people who are ill, or they can't bear to see blood, or they don't like to see people in pain. I don't like to see people in pain, but what I realized was that I was able to make them feel better. I helped my father take care of his parents, and his mother had diabetes and needed shots, and my grandfather, I was the oldest grandchild, so my grandfather kind of doted on me, and he had cancer and needed to have medications for his pain from his cancer. And my father taught me how to give the insulin shots to my grandmother, and my grandfather, bless his heart, had me give him his pain injections, medication. And then what I also noticed was those were the days of the family doctor who would make visits. And my grandfather's doctor would come by to pay a visit either when my grandmother was ill or with his condition. And it just seemed to me every time the doctor left, everybody felt better, you know, and so I saw this healing art as something that I thought I had a knack for. I don't like to see people suffer, and I thought I was getting a taste of what you might be able to do to make people feel better. My mother had been experiencing pain in her back, and the doctor was treating her for poor posture and didn't make the diagnosis of the bone cancer. I was in Boston and she was in Virginia, but obviously never took an x-ray because he would have found that bone tumor in her hip. It came as sort of a surprise when my father found this knot in her hip, and it turned out that she had a bone cancer that had actually grown through the bone. And she was transferred to a New York hospital, and I did not want to leave her there. So I went to Wellesley and sort of was apprehensive, not knowing if they'd give me a leave of absence, but asked, could I take some time to be with my mother? And they were very generous, which influenced my later career as a dean of a school to be more understanding when our students have family responsibilities, because I've been through that myself and know what a difference it can make. And I did stay with my mother and went back in the second semester. How that affected my career was in two ways, really. One, it really firmed up my desire to be a physician, because I saw what we went through. I had seen this doctor just totally misdiagnose my mother's condition and really be rather arrogant with her, telling her to do her exercises and get Oxford shoes, which were not going to cure the cancer that he never diagnosed. So I wanted to make sure that there were doctors who really paid attention to patients, knew to listen to patients, because patients know their bodies better than we do. And also knowing there was no cure for this cancer, I think like everyone, I wanted to do cancer research. I'm not sure I even knew then what cancer research was, but I wanted to do cancer research so we could find answers to curing cancer, since there was nothing that could be done for my mother's tumor. So I had that semester to make up after my class in March. And the Wellesley Placement Office had summer job postings, and the first job that they gave me an interview for turned out to be with a transplant surgeon at Mass General Hospital. And so I went to interview with him, and it really was a permanent position, but he knew I was going to go to medical school, but he hired me anyway. And so I worked with him that summer. He kept me on during the fall while I commuted back to Wellesley to finish my last semester. And then I worked for him up until I went to medical school in the fall. And what that did was, just by chance or coincidence or happenstance, what had been a tragic event opened up a whole new vista of opportunities for me, because it got me into medicine at Harvard Medical School, not at the medical school, but you know, Mass General is a Harvard teaching hospital. Because of working there that summer, I came back every summer during medical school to work there. So I got exposure. I learned early about the kidney. I learned early about transplantation, which we're talking about 1962, was considered research then. It had not become the standard procedure. And it really then opened the door so that I was invited to come do my training there. So that semester, making up that semester in that one job, making up for the time I took out from my mother, changed my whole career, because I had thought about being a pediatrician. I had not thought about being a researcher. I had not thought about being in pathology. I never thought I, as a black girl from Virginia, would get into a Harvard teaching hospital. And the next 30 years of my life were spent in that field. So it really had a long-lasting impact and gave me many contacts and mentors that have helped me up until today.